slides. Thank you very much.
Hello, good morning or good afternoon, everyone. I'll be speaking about accessible personalized medicine. So basically, I think the issues in healthcare are the same in the last 30, 40 years. I think not changed. It's not really ideal, right? Especially it's very costly, and these high costs are a big increasing issue worldwide. We are working on a platform, and you will see more information about this in this talk, about a proactive and hypothesis-free health testing platform, which is basically a result of our extensive, highly curated proprietary biobank. And the objective is to build an affordable and accessible general health assessment tool at a fraction of cost of today's standard of care. The opportunity is to disrupt precision medicine, and this will be possible with extremely cost-efficient approaches to gain deep health insights. First of all, think of a general health assessment like this, offering information about inflammation status, energy metabolism, liver, kidney, muscle, neurohealth, cardiovascular, insulin resistance, which tells you decades in advance if you will develop diabetes, for example, GI issues, pancreas health. Now, if you would like to get this type of testing with today's standard of care, the value of this information is about $1,000. We have it at the cost of a pizza margarita. And I will also tell you how this is possible. So we are basically integrating NMR measurement, that's a magnetic field technology, and AI. And by the way, we are not an IVD company, we are a data company, we are using MedTech, and our MedTech is a software which is part of the measurement. We use metabolomics to turn this into an affordable tool to democratize precision medicine and enable population-wide screening. What is metabolomics? It's a new thing, right? So genomics, we all know, basically the genes tell you something about the potential of a disease you may develop at some time or at some point of your life. Transcriptomics, we all know with the liquid biopsies, what the stories about transcriptomics, great powerful tool, still nascent, but also a bit pricey and still issues with certainty of the results. Proteomics, getting much closer to the actual phenotype of the patient, but again, the cost point is prohibitive for frequent use. I'm here to talk about frequently used tools which can make it into checkup medicine. When you look at the metabolome, that's the sum of all metabolic reactions in your body, you get the immediate health status. You get the phenotype of the health. And this is possible by capturing hundreds of metabolites quantitatively. One of our board members is a Nobel laureate, and he's basically saying, Jim Rothman, you cannot get closer to understand disease than by looking at the metabolome, because almost all diseases are linked to the metabolism. We extract the metabolome as an information layer. This information layer can be used for information in preventative care, like checkup medicine, diagnosis of complex disease, and treatment monitoring. Because when you can see disease, you can also see if the disease is changing as a response to treatment. But now I talked enough. Now let's watch a movie which explains you what exactly we are doing. Audio, video. Just a second, we need audio for the full experience. Let me know when it's ready. Ready? Ready? Awesome, thanks. Great. How do I move next? Some of the control doesn't let me control. Oh, here. Okay, now.
Lifespin, the health data revolution.
Lifespin only needs 0.5 milliliters of blood. Lifespin takes only one measurement for all tests. The NMR instrument is the interface between the physical and digital world. The patient's metabolomic information is being captured in one single scan with radio frequencies. Lifespin's AI generates hundreds of clinical parameters from the metabolomic data and compares them to hundreds of thousands of human profiles. A personalized health compass is being generated, assessing your health against hundreds of conditions. This data is being compiled into a detailed health report, offering insights into diagnostics, disease progression, and treatment success. But Lifespin's vision for deep health goes beyond today. Powered by an AI foundation model, our technology will understand NMR spectra as precisely as GPT models understand language. And specifically trained transformer models will analyze all possible health conditions simultaneously, constituting an omni-intelligent health software. Lifespin empowers you with detailed, actionable insights. Complex health data is transformed into accessible, affordable, personalized health information. Lifespin, enabling personalized medicine for all.
So you can visit us in Regensburg, Germany, to also get your own personal profile done. So as this is a very powerful technology with deep health insights, we are looking at a huge market. It's a $400 billion market opportunity. We are starting the expansion in Asia Pacific, because Asia Pacific has a huge private payer system, which makes it very amenable for new technologies, especially when they are software enabled. After Asia Pacific, we have in parallel business activities starting in Europe, then followed by a business in the US. We are raising now about 10 million euros in 2025. Use of proceeds will be first to further enhance our technology, to also build the AI transformers, which you have seen in the second part of the movie, then basically fuel more clinical trials, and then building the market for new modality obviously needs also resources. First of all, we are now working already with top-notch hospitals in Asia Pacific, strong in personalized medicine. This will be continued by building the market furthermore, and of course, looking at the regulatory affairs, we will have the first products actually under CE mark. Again, this is software as medtech, where we basically go after CE mark initially, then followed by FDA and other pathways. Okay, thank you very much.